for you all. You can prepare. So I want request children to spend little time with me. When we discuss about children fitness, the motor development in children, first thing we need to know, sports development, physical skills in children. Okay, with sports development, physical skill in children are developed. Sports not only promotes physical fitness but also provides recreation. Okay, development of sportsmanship also helps children in developing social qualities. The lesson learned during children sports will shape their bodies, values and behavior for adult life. So through sports children get shaped bodily, and then values, they get good values, moral values are developed, and then behavior as an adult becomes too good. So children in sports need to be encouraged and promoted. Okay, so meaning for motor development is referred as study of changes in movement behavior. Motor development is changes in movement behavior. This deals with changes to the motor behavior for whole span of life. According to Gallego and Hoseman, as a process, it's defined as a process. Motor development involves uh, the underlying biological, environmental, and task demands influencing both motor performances and movement abilities of individual from infancy through older adulthood. As a product, motor development may be regarded as descriptive or normative and is typically viewed in stages infancy, childhood, adolescence, and adulthood that reflects the particular interest of the researcher. The motor development has two types of skills which are explained: gross motor skills and fine motor skills. Gross motor skills involves the large muscles of the body that enables such functions as walking, kicking, sitting upright, lifting and throwing a ball. A child's gross motor skills depends on muscle tones and strength. Mainly the gross motor skills play an important role for activities like walking, maintaining balance, coordination, jumping and reaching. Fine motor skills. The fine motor skills involve skills of the muscles of the body such as finger and hands. They consist of activities like writing, grasping small objects, fastening clothing, etc. These skills are also important in the field of sports, as holding of badminton racket, lifting in volleyball, spin bowling in cricket, etc. These skills are important in studies also, as ability to eat, write legibly, use a computer, turn pages in a book, etc. depends on the motor skills. Okay, so now about motor development in a child. So infanthood, then we go for early childhood, then we go for middle childhood, then we go for later childhood. These are the divisions. As per many research, we have come to this division. It started with Sigmund Freud's division, and then Erickson's division. They were all psychologists and neurologists, and this motor development finally has been given a shape. Motor development only happens when the child is biologically and mentally ready for it. It is well known that the motor development progresses from gross motor skills to fine motor skills. There are 4 stages of motor development in children: infanthood, then early childhood, middle childhood, and then later childhood. Infanthood, this period from birth and lasts till the age of 2 years. The motor skills begin at the age of 6 weeks. The infant starts holding the head in upright position. sorry. At the age of 2 months, the infant starts lifting arms. They start rolling from to side to back at the age of 2 months. The grasping activity begins at the age of 3 months. At the age of around 7 months, starts sitting and crawling. Then the infant starts pulling to stand at the age of 8 months. Infant starts standing and walking at the age of about 11 months. So in this way, I am thankful my son started walking at 7th month itself. Although the sequence of motor abilities is uniform in infants, but differences may exist individually in the rate at which motor skills develop. Then next is early childhood. Early childhood is the period between 2 to 6 years. This period is characterized by rapid motor development. This is also known as preschool years. At the age of 2, children learn to kick. Activity of throwing starts at the age of 2 to 3 years. Balance mechanism develops by the age of 3 years. Child starts walking like adults at the age of 4 years. The child tries to attempt running also by the age of 4 to 5 years. The child starts controlling running. The child starts running like adult at the age of 5 years, and the child can hop and gallop skillfully and jumping for longer distance at the age of 5 to 6 years. That is why this formal PT periods are mostly after 6th standard. So for other age groups, we slowly increase the activities. So now middle childhood is, this period refers to the age of 7 to 10 years. After the age of 7 years, the child moves towards perfection of movements like running, jumping, throwing, and catching. The ಅದೇನದು okay, you write a letter what happened. Okay, you write a letter what happened. Okay. And then because okay, this one is that the class அடிச்சிட்டாங்களே அது. Okay, okay, okay. So here now let me complete this lesson. It's about how field athlete triad happens, and the fact of athletes triads are disordered exercise, then osteoporosis. These are the important top points you need to know. Disordered eating. Okay, so when people don't they want to reduce weight, in some of the events they don't eat properly, and that results in anorexia nervosa and bulimia nervosa. Psychologically, not too much eating, or after eating trying to vomit it. Okay, and athletes participating in endurance sports like cycling, distance running, swimming often may get developed disordered eating. Many sports have weight categories like judo, boxing, taekwondo, wrestling, etc. So athletes try to lose body weight and get addicted to disordered eating. So that all this disordered eating results in triad, female athlete triad. And osteoporosis is characterized by low bone mineral contents. Because of this, there are three things that is in this female athlete triad. So one is disordered eating, another one is osteoporosis, and another one is amenorrhea. Okay, so क्या कर रहे थे? So now about osteoporosis. Osteoporosis is characterized by low bone mineral contents. This leads to increased porosity of the bones. This results into increased bone fragility. The risk of bone fractures also increases. On live session. Today he will know. Today we will know. Today he will know. our duty போட முடியாது. Today we will know. He has gone to hospital. சர்ஜரி இல்ல பட் ரெஸ்ட் தான். டுடே ஹி வில் நோ. அதுதான் 15th வரைக்கும் ஹியர் வி ஹேவ் given. டுடே வி வில் நோ. பேப்பர்லாம் பார்ப்போம். I'll tell you madam, I'll update you. So this is about osteoporosis. Again I am in the school, and I thought I will complete this because physical education exam is on 17th. So whoever needs to hear this, once you can hear it, just hear it whenever you have a leisure period, and then take your book, go through it, you will get good marks. So physical education is an easy subject. Just don't fear, little bit hear it, and then you can write your own words. Only thing, you remember these points and then write your words, because you are in 11th, you will surely be good if you have opted sports children are more intellectual. So osteoporosis is characterized by low bone mineral contents. This leads to increased porosity of the bones. This results into increased bone fragility, and then the risk of bone fractures also increases. And osteoporosis is weakening of the bones due to the loss of bone density and improper bone formation. And then this condition can ruin athletes' careers because it chores and other injuries. So this is about osteoporosis. Inadequate physical activity may develop osteoporosis. So now the third one, the triad. Okay, the third one is amenorrhea. Amenorrhea, participation in vigorous exercises and not eating adequate calories can lead to decrease in the hormones that helps to regulate the menstrual cycle. This can lead to irregular periods and may stop altogether. Of course, it's normal for teens to occasionally miss periods, especially in the first year. So for the teens, need not worry, because there are kids who worry because after years they get their next cycle. So they need not worry about it. Now the symptoms of athletic triads are here it is. Okay, the following are the symptoms of female athlete triads: excessive weight loss, no periods or irregular periods, accumulation of fatigue, lack of concentration, occurrence of stress fractures, continuous dieting in spite of weight loss, and then obsession with food and weight, then consumption of laxatives, and then dental cavities, low heart rate, low blood pressure. So this is for athletes triads. Okay, these are the symptoms. What is anemia? Anemia is a condition in which a person does not have enough healthy red blood cells to carry adequate oxygen to tissues. These are many forms of anemia. There are many forms of anemia, each with its own cause. Loss of blood is the most common cause of anemia. Anemia can be temporary or long term, and it can range from mild to severe. The treatment for anemia starts with taking supplements. The following are the symptoms of anemia: fatigue, weakness, pale skin, a fast or irregular heartbeat, shortness of breath, chest pain, dizziness, cognitive problems, cold hands and feet, headache. Initially, anemia can be so mild it goes unnoticed, but symptoms increase as anemia worsens. Okay, so take care as athletes and eat nutritious food. Now, psychological aspects of women athletes. It is well known that there is always differences in sports performance in different genders. There are rumors factors for this, but still in sports such as running, a woman who is fit and well trained can outperform a man who is not. However, in the games which requires more balance and concentration like shooting, equestrian, women can compete at par with men. Following are the psychological factors affecting self performances. Trainability, when there is no perfect training, and the women always try new techniques. According to Mike Candria, women are much more willing to give you their hearts and best efforts. Male athletes tend to be more influenced of their own competence. This is the reason they are less trainable as compared to women. So it's because of the trainability many women are performing good. So many studies have quoted that women tend to be more coachable since female try to be more open to coaching. And then confidence level is more in the women. Aggression, the arousal of aggression is lesser in a woman. That is why many competitive sports took slow development due to weak in strength. Women slightly less aggressive. Okay, they are less aggressive than men. Okay, and then women also lack in confidence. The women who has confidence can do better. Sensitivity, women tend to be more sensitive to comment that are made on them. When people comment on them, they stop doing. Like even me, when I am in swimming dress and when I share those pics, people make fun of me. So that's sensitivity. When people spectators comment, when your relatives comment, we are offended if loud and blunt language is used by teammates. All that happens. And reaction to stress, it is well known that men have tendency to take fight or flight approach to deal with stress. Men normally go for flight or fight. However, women have tendency as tend and befriend. They tend and befriend. So when we take up stress, men go for fight or flight. Women go for tend and befriend. They join social groups for support and resources. Women generally tend to have larger social support that helps them in relieving stress. Women are generally expressive in showing their emotions. They communicate with others to resolve various stressful situations. Coping. Coping refers to the way a person reacts to stresses. Women tend to use different coping styles in comparison to men. Okay, so stress, then coping, all these are the important parts. Women are more good at these things. And personality, we all know, not many personality differences can be highlighted between men and women. Sports persons, yet some studies have indicated that women are higher in neuroticism and agreeability. So when we take up personality, women have higher neuroticism and agreeability and lower on openness to new experiences. These differences may be responsible for the differences that emerge in sports performance. So when we take up personality, women are higher in neuroticism and agreeability. They agree to whatever happens, and they are very low in openness. They don't open up to the new experiences. So under these topics, please write the answers. Okay. And social aspects of psychology participation, sports participation is safety and transportation issues, and then social stigmas, like though we are in a recent modernization, discriminations are still there, that gents only will be in sports. Still discriminations are there. Lack of facilities also discourages women, and lack of role models. There are not many as role models, but now in present era we have many women teams coming up, like cricket is doing superb. Less media coverage for women's sports, and then scarcity of women coaches, then cultural sensitivity. There are people like they say no, in our culture this is not allowed, this attire is not appropriate, and so many things, and fewer spectators. We all know cricket matches used to be there even before, but now slowly spectators are coming. We are watching it in the, but compared to men cricket, women cricket has less importance among the public, but still now it's coming up. So the last point let us discuss is ideology. Okay. Ideology refers to ideas reflecting the sorry social needs and aspiration of an individual group, class, or culture. So women participation in the sports is a subject of discussion. To discuss this topic, women participation in the Olympics can explain the development of women participation in sports. In 1900, by Paris Olympic Games, just 22 women athletes out of 997 athletes participated. Women participation has increased steadily. This can be judged from the following tables. So 1996 to 1952, you can see the participation. 1996 nil, number of sports were nil, so no events went on. And then 1900, after 4 years, 2 sports were there, and 2 events were there, and 22 participants were there. And slowly 1896 no women participated. So 1900 2 sports and 2 events and 22 participants were there. These are women participation. By 1952 6 sports came, and the number of events are 25, and then participants were 519. So get updated. I have with me only till 2012. So here it is. So by 2012, 26 events, and then 26 sport and events were 140, and then participants were 76. So now so many things, so many changes have come. So get updated, and thank you. This was about children and women in sports. So the important questions that may come are 3 marks questions may be: explain any 3 reasons for less participation of women, or what is amenorrhea, then there may be what is menopause, write about osteoporosis, 3 psychological effects of women for sports performance, and there may be even menstrual dysfunctions, and write short note on pregnancy or ideology of women in sports, like how many participated with time. So this may be for 3 marks, and 5 marks may be causes of less participation of women, or maybe what do you mean by menarche, and the menstrual dysfunction. There may be even what is pregnancy and menopause. An essay on athletic triad is most common question all the time. Okay, so thank you all of you. And ideology of women is nothing but how women started increasing. So 1896 no participation of women were there, and then with time it increased. Okay, so thank you all of you.